Okay. Well, hello, everyone. Good morning, good afternoon, good evening, wherever you're hailing from. My name is Stefanie Austin. Thank you so much for joining us today. I am the Executive Director of Global Chamber Dallas-Fort Worth, and we have our chair here, 𝗙𝗰𝗶𝗶𝗁. He is our board chair as well. And so we just want to say thank you so much for joining us today to learn so much about healthy heart. February is Healthy Heart Month. And so I want to share my screen here with you all. Let's make sure I stop sharing. I would like to share some information with you. I love, sharing pictures and to kind of help people to relate to what's going on. So I hit share. There we go. Okay, screen 2, share. Wonderful. So make sure, let me know if you're able to see my screen so I can show you. Well, this is a picture perfect bird. Do you see this parrot here? Do you guys
Yes.
see that? Isn't that gorgeous? I mean, God's creation. I'm sorry, I'm gonna have to talk about the Lord's creation. I mean, look at the details of this bird. This was not what I was gonna show, but I've been watching this. Look at the blue feet.
Yeah.
Isn't that gorgeous? The red tip nose and the orange and all the different yellows. And so God is just wonderful. So I just thought I'd share that moment with you all as I was watching it so that you can enjoy it as well. So as I mentioned to you earlier, my name is Stefanie Austin, and we are going to be talking about Heart Healthy Month. And I would like to also share with you about what Global Chamber is, what our mission. And our mission basically is to accelerate business across borders, whether it's across the pond, whether it's in other states, collaboration, warm connections, and connecting people. And that's basically what the Chamber is. We're an organization that's in 525 metros, 195 countries. You might say, okay, Stefanie, so what's the difference between a regular chamber and the global chamber? Well, a regular chamber is just that. They're the chamber of their city. I live in Frisco, so Frisco has a Frisco chamber, and they operate within their city of what the things that they're doing. Global chamber operates across the United States and across the world, and that's what makes us a difference. So whenever you're a member of Global Chamber, you're a member of 525 chapters in 195 countries. That's what Global Chamber is. And then what our vision is to be effective leadership requires understanding, resilience, creativity, diversity, innovation, opening up, being open to all new things, what's going on, and being willing to learn and to listen and to share and to collaborate. That's what our vision is all about. And our values, as I mentioned, global connection, success depends on relationships. So in order to build a relationship, you have to spend time with people. Think about relationships you have with your friends or your significant other. Those relationships are built upon, and that's by spending time. Leadership requires understanding and resilience. As a provider, there's leadership, there's understanding, there's resilience, there's patience, diversity essential for success. Equity and inclusion, we have to include everyone. You can't have healthcare and don't include everyone. You can't have a bank and don't include everyone. Everyone's money is green. And so I wanted to share that. And so, as I mentioned to you, we're in 525 countries, as you can see, North America, Europe, Africa, South America, Asia and Pacific, and we're in 195 countries, as I stated earlier. So, without further ado, why are we here today? Heart Healthy Month. This is why we're here today. We're here to hear our speakers of the hours, Dr. Mohamed Kaba, Dr. Merilyn Tunstall-Stroman. They are the experts in their area. They're going to share with us the importance of Heart Healthy Month and why it's important to have a healthy heart. Our heart is one of the largest organs in our body. But don't take it from me. I'm not the medical person. We have the two experts here that is joining us here today. And so what I'm going to do is talk to you a little bit about Dr. Merilyn Tunstall-Stroman. One, she's a colleague of mine, and I've known Dr. Stroman for maybe a few years now. She's experienced in healthcare provider. She had 15 plus years in healthcare, specializing in oncology, mental health. She's a family practitioner. She works for the Center for Cancer and Blood Disorders. She also does mental health, works for University Behavioral Health of Denton. Her education is Drensel University and also University of Texas. She also teaches. It's like she wears so many hats, and she's a great mom, great wife, and she teaches as well. Sometimes when I talk to her, she has 3 or 4 jobs. I'm like, how are you managing that and doing it well at that? And so, as I mentioned to you, she's a teacher in leadership over at Baylor University. She's a community involvement. She volunteers in the community. She advocates for mental health and awareness. She volunteers at our church, being a medical provider on the team. And so that is who Dr. Stroman is. She's a wife, she's a mother, and she's an avid traveler. And she's at work right now. So she's at work right now. And so she's definitely so much. We appreciate her time. And then we're going to talk about Dr. Kaba. Dr. Kaba is here with us today as well. He's a public health specialist. His background, he's from Guinea, West Africa. He is a Mandela Washington Fellow, and that's very important because we partner with Mandela every year when their fellows come through. He has over 10 years experience leading company and immunization projects. And so Dr. Stroman and Dr. Cobb would be great for you all to collaborate, especially Dr. Stroman has done a lot with COVID. He serves as an immunization officer. He has his doctorate in medicine, master's in public health. He has his advanced postgraduate diploma in clinical pharmacology, and his expertise is strengthening national and international immunization programs. So what we're going to talk about today, this is going to be a very interactive presentation. So we're going to definitely want you all to put things in the chat. So you already gave you the answer. So what are we talking about today? And I need you to put that in the chat. And the hint might be on the screen. The hint is there on the screen. All right, so yes, let's see what the chat is sharing. I'm about to take the screen down here, stop sharing. Should have stopped sharing, yes. So, oh, wait a minute, no one put anything in it? Oh, no. Okay, I'm sorry, so you're not gonna put it in the chat. Okay, so Michael, what are we discussing today? That's okay, if you don't want to put in the chat, I will call names, that's okay. Michael, what are we discussing today?
I did say heart health.
Yes, okay. Ruby, what are we discussing today? Wendy, what are we discussing today? Dr. Michelle Moon Thornton, thank you so much for joining us. What are we discussing today? You guys can put it there in the chat if you don't want to come on live. Terry, what are we discussing today? Heart health. Okay, thank you.
Liqueur.
What do you say?
I was trying to say the heart in French.
Oh, corazon.
That's Spanish.
And what were you saying? What language were you saying it in?
I thought French. Liqueur, isn't that right?
Oh, I'm not sure. I'm not a French expert. So, but Terry is. Terry.
Le cœur. Your heart is le cœur in French.
Le cœur.
I was right. I mean, I didn't pronounce it right, but I was right.
All right. Well, yes, we're going to talk about heart disease, and so we're going to bring Dr. Kaba and Dr. Stroman to the forefront so they can start, and then we'll be able to ask some questions along the way. Dr. Stroman, I guess I'll start with you first. Can you just tell us, and if you guys can take your microphone, there you go. What is heart disease? Can you tell us that?
Well, thank you so much for having me today, first of all. It's very nice meeting you all. But heart disease is a layman's term for cardiovascular disease. So it's not just the heart. We're looking at blood vessels within our body in general. We're looking at the heart as far as the muscle. We're looking at the valves of the heart. We're looking at any conditions rising within the heart as far as like irregular heartbeat, whether it's too fast, too slow, or just irregular, like a atrial fibrillation, which is a common disease also. But so heart disease isn't just, one specific thing. It is a mirror of, or it's a umbrella of different disorders that can be classified as cardiovascular disease. There are multiple symptoms, there are multiple treatments. Oops, I don't know what happened there.
You're there.
Can you guys see me? Can you guys hear me okay?
Yeah, we can see you. Yes.
Okay.
Okay.
there are multiple categories underneath just heart health in general. So for one thing, blood vessels. So blood vessel disease could be coronary artery disease. The coronary arteries are the actual vessels that feed the heart muscle with blood supply. Then you have your regular vasculature just throughout your whole body. So you can also have like atherosclerosis, which is a hardening inside the vessels of the heart, or just of the vessels in general. Heart valve disease, like the valves of our heart, the aorta is a big one. Your aorta, the aortic valve sometimes can be too narrow. It's called stenosis. And if it's too narrow, you're not getting enough blood flow out of the heart. And then there's symptoms there's symptoms that go along with that, but there are 4 different valves within the heart, and each valve can have different levels of disease to them. I did talk a little bit about irregular heartbeats or arrhythmias, whether it's AFib or atrial fibrillation. There's also tachycardia, bradycardia. There's different reasons and symptoms of why someone would develop a arrhythmia. So there's multiple things that come along with heart health, and we can go on and on and on and talk about this.
No problem, no problem.
It's a lot that goes on
Yes.
to heart health and how it affects different parts of the body and different organs in the body.
Thank you so much, Dr. Stroman. Dr. Kaba, I would like for you to chime in. And also, I guess my question I would like to add regarding that is, how do cultural factors play a role in heart disease prevention and treatment? But if you'd like to elaborate on what Dr. Stroman said as well, that's fine.
Yeah. Thank you so much, Doc. Thank you so much, Stefanie, for has already explained all the clinical aspects related to the heart disease. I don't know if you can hear me very well or not.
You're breaking up some, but we're managing. Okay.
Okay, it might be the network. So I said Dr. Stroman has already explained very well the clinical aspect related to the heart disease. So just going to come out related to the public health context. I mean, to the heart disease. So speaking the heart disease, we need to understand that heart disease is among the non-communicable disease. So today, non-communicable disease, including the heart disease, stroke, cancer, diabetes, and chronic lung. 74% of all death worldwide. So more than 3/4 of all non-communicable disease death, and 86% of the 70 million people who died prematurely or before reaching 70 years of age occur in low and middle income countries. So it is a bit difficult to discuss about heart disease alone. So it will be very important to discuss heart disease and also blood vessels, has said Dr. Stroman. This both combined will be a cardiovascular disease. So they are both currently a leading cause of death globally. So also in the USA, 1 in 10 people affect about the heart disease. So even in Africa, cardiovascular disease are the largest contributor to the total non-communicable disease burden, accounting 38% of non-communicable death and 22.9 millions of daily. I mean, the quality of life of affected. So we have many factors. So I will, when I say factor, the different common factors related to the heart disease. I mean, all the non-communicable diseases, tobacco use, physical inactivities, and the alcohol use, unhealthy diet, and air pollution. So I will just stop here.
Okay.
This is the public health context that I just wanted to add what Dr. Stroman said. Thank you.
Thank you. Thank you so much, Dr. Kaba. I appreciate it. So I'm going to have, if Jim, if you can put them both on the panel side by side, that'll be great if you can pin them, because I want to ask them these questions together here. So in thinking about, so I'm going to talk about it more in layman terms, right? Is heart disease hereditary? Either one of you, Dr. Kaba or Dr. Stroman.
Okay, I'll go.
Okay.
I'll say a little bit. So there is like a hereditary component. There can be a hereditary component to cardiovascular disease, as far as patients having a family history of high cholesterol, which is a big, you could say it could be a part of just our dietary intake, but for the most part, yes, dietary. But there is a family component where it may be mom, dad, grandparents, all have high cholesterol. There are specific testing that can be done to test for someone's risk factors as far as high cholesterol is concerned. I would also say that there is like lifestyle that just kind of goes along with different generations. Like, oh, my mom ate this. This is what we grew up on. You know, this is what my mom made every night, or this is the foods that we ate. So it could be something that just within the family or the culture, eating fried food, fatty foods can also contribute. So, I mean, I can't 100% say yes, there is a genetic component or a hereditary component. Yes, there is to an extent, but some of it is also the foods that we eat, and maybe not as much as far as sedentary lifestyle, where, some families are very, very conscientious about health and exercise, and some families really aren't. And that can play a role in heart health. A sedentary lifestyle is a very big risk factor for developing heart disease.
So remote work is not the ideal work for if heart disease, because when people are working remotely from home, or from an office, you're sitting all day. And we probably have more younger people now that are doing more sedentary work than we had years ago, when people are in the office or working out working outside, the case may be. So I would really love to see what those numbers are going to look like over the years, when we start looking at people who have worked more remote jobs at home and what their heart disease outcome looks like. Dr.
Well, I think even past, working at home, you can work, 7, 8, 9 hours at home, but getting up regularly, getting up and going for a walk, or, when you're finished with work, going to work out is going to still help. Just because you're sitting at home during your work hours doesn't mean that, when you're off of work, you can still go and work out, 30 minutes a day, would be very, very beneficial for cardiovascular health.
Wonderful. I'm going to come back to you, Dr. Stroman, because I'm going to want to know about, are there any exercises that you can do while you're sitting at home, at work, and working from home, and ask me. So Dr. Kaba, would you like to add anything in regards to the hereditary? You know, you're doing public health. What are your thoughts?
Yeah, yes, some research has demonstrated that family history plays a significant role in an individual risk of developing heart disease. It is true that genetic factors can predispose individual to conditions such as high blood pressure, high cholesterol, and other cardiovascular disease. So, how Dr. Stroman said, genital factors, certain heart conditions like familial hypercholesterolemia are inherited and can lead to early onset heart disease. For instance, individuals with a family history of coronary artery disease have a higher risk of heart attack and stroke. So I can say that yes, a lot of research has demonstrated that a family history is related to the heart conditions. Over.
Okay. Well, thank you. Thank you. I appreciate that. So I have another question for you all in regards to stress. Dr. Cobb, I'm going to start with you. In regards to stress, how does stress contribute to heart disease? I'm going to come to Dr. Stroman, and then we have a special guest, Dr. 𝗦𝗃𝗶𝗶𝗁𝗃. I'm going to pull her to the stage shortly because she talks about stress and unmasking and what we do as women. But let's start with Dr. Kaba, Dr. Stroman, and Dr. 𝗦𝗃𝗶𝗶𝗁𝗃, and I'm going to be grabbing you shortly. I know I didn't give you a heads up, but you're always ready. So, Dr. Kaba.
Yes, chronic stress can negatively impact heart health. Someone that is always under stress, stress can increase the high pressure hormone. So, if you are under stress a long time, I mean chronic stress, that can really lead to the can lead or impact very negatively your heart condition. That is why practicing stress reduce techniques such as meditations, deep breathing exercise, and mindfulness can be very beneficial for everyone. So chronic stress really leads negative impacts on our heart health. So thank you.
You know, you wouldn't have, you know, growing up, I wouldn't have thought about that, you know, and even as a young adult, because, you know, we've been underneath a lot of stress, and I did not realize how stress can impact your, you know, can contribute to heart disease. So Dr. Stroman, would you like to add to that, especially with you also being in mental health, and you see this on a regular basis? She wears several hats. But on the mental health side and also on the cancer side, I mean, you know, blood disorder side, can you speak to that? You're on mute right now too.
Yeah. So one, mental health is very important because it affects all aspects of our lives. If we're not feeling good mentally, we're not going to be taking very good care of ourselves either. So, you know, increased depression, patients, you know, lose motivation. They lose interest in doing things. They start to not care about themselves as far as keeping up with things. So, you know, someone that's not taking their blood pressure medicine, you know, or they're not taking their medicines in general, they're not following up with their doctor's office and their appointments, you know, they're not exercising, you know, the things that are supposed to keep us healthy and keep our bodies strong, our temples, you know, strong. But also sleep plays a big role in helping our bodies in our brains to heal. For one, you know, detoxifying itself, helping us to get a good amount of sleep is going to be really important for mental health. If you're not sleeping, you know, most patients have issues with increased frustration, low tolerance for stress. They're quick to anger, quick to have more issues with anxiety, which, in general, that, anxiety, increased heart rate, increased stress, increased heart rate, blood pressure increases, more stress on the heart in general because of that. The mental health plays such a role in our daily lives, making sure that we're taking time for ourselves. Walking or just regular exercise helps our mental health and our heart in general. So making sure that patients and just anybody in general knows we can work on our heart and our mental health at the same time by just going for a walk, just meditating to increase our level of our stress throughout our day. Getting enough sleep is going to be important. Outside of eating too, decreasing your salt intake. If your salt level is really high, that's going to increase your blood pressure. That can increase your body's holding on to fluid, which causes swelling. People will notice swelling in their legs and their ankles, or their feet more than if they didn't have high sodium levels. It's just a variety of things that we can be doing, just small things that we can be doing to help improve our overall health. But mental health in itself, it starts with the head and works itself throughout our whole body. If our brain is not doing well, the rest of us is going to struggle too.
Absolutely. Thank you, Dr. Stroman. It's really funny how women, and, we mask all the time, and because we're concerned about, and men, I'm not excluding you. So just,
yeah, I'm about to say,
we're not excluding you.
It's not just women. It's not just women.
But women mask because they're trying to take care of everyone. They're trying to be this face for everyone. They're trying to do this and do that. And they don't take care of themselves and recognize it. And I want to bring Dr. 𝗦𝗃𝗶𝗶𝗁 because she has a wealth of knowledge that she can share with us in regards to mental health and stress and the masking and unmasking. And Dr. 𝗦𝗃𝗶𝗶𝗁, I know I put you on the, I didn't give you any notice, but here you go. You're always ready. Do you mind providing some insight?
Absolutely, absolutely. I will provide the insight. Just thank you for calling on me. I talk about masking, and I've done workshops all over because, especially from a cultural standpoint, we growing up are never taught how to express our emotions. And sometimes we're never even allowed to have emotions. I can remember, being a little girl upset and crying, and my father would be like, "What are you crying about? You ain't got nothing to cry about." Or it was always a pressure to be happy, even from when children are born. If they start crying, everybody's rocking the baby, putting pacifier. They want them to be happy. And so what you teach people is that you should always be happy. Because, if you start complaining, nobody really wants to hear that. You got to suck it up and do this and that and the other. So because everything, even in social media, is focused on happy, we feel like we should always be happy and mask our emotions. And because we do that, that causes not only stress and anxiety, that leads to physical illnesses and everything else. So it is really important for us to be able to manage our emotions. And emotional wellness is key. Just like we work out every day so our body looks right, we have to do something mentally every day to manage our emotions. And talking about them is a good way to start.
Yes. And I didn't do you injustice by introducing who you are because, I know who you are. But Dr. 𝗦𝗃𝗶𝗶𝗁, she's the ambassador, is a distinguished leader. She's a humanitarian. She's an educator whose life's dedicated to empowering individuals across the globe. She just came back. I think she was in Nairobi. Were you in Nairobi this summer?
Yeah.
She's on the East Coast. She's in I want to say, in
Virginia.
in Virginia, okay.
Mhm.
Her profound impact on mental health. She has a background in mental health, education. She's earned numerous accolades, including the prestigious I Change Nations, Stanford of Excellence Award. She's named in her honor a testament to remarkable contribution to society. She's a wonderful wife, a wonderful mother, sister to all and to many. And she wrote a book. And you want to share, please share the name of your book and tell them about it. But I brought her on because I had the pleasure of hearing Dr. Michelle Boone Thornton when we were in Puerto Rico at a Transformational Writers Conference. And darn, I have my mask. I had it downstairs. I should have brought it up. But it's a mask on different colors of how you mask things as a person and as women, and how this is all people see this when every time people see me, like, oh, Stefanie, you're always smiling. Well, I'm hiding behind the smile just to keep from crying, or nobody really wants to hear how you're doing, or they don't even want to hear about it all the time. Like, man, she's still in that same place. So we mask it, and so I brought her forward because she speaks to so many people, so many women. She has so many accolades and different things. But please do share the name of your book. I didn't bring her up to sell her book, but the book is great. So being that I brought her forward, this is a bonus on me to you all.
Well, the book itself is called Transforming Your Reality, Removing the Mask. And it is a three-series book. And right after COVID, I wrote the workbook because, it was laid on my heart that people need to do something and be able to do something now. Everybody is not at the point where they want to go see a therapist, lay on the couch, or talk about it, but it gave you the opportunity through scenarios to start just working on your own stuff at your own pace, in the privacy of your home. And then from that, I developed a companion journal, right? Because when you start thinking about the emotions that you mask and why, you really need to journal that. Because that'll tell you the story, the real story that you've been hiding all that time. And so the last piece in that whole series is the actual full book itself, which explains why we mask. Don't be ashamed because you've never been taught how to manage an emotion. Don't be ashamed because you can really only verbalize happy, sad, glad, mad, when there are 92 other emotions that you have just been hiding all of this time. And so in that workshop, I take a paper mache white mask, and then I give each person a different color for a different feeling. So depression is blue, envy maybe is green, frustration is orange, red, those colors. So people start to paint these masks the way they really feel inside. And so at the end, I say, look at these beautiful faces, and everybody's showing their face. But what is underneath it is this mask that's now filled with all these colors of emotions. Those emotions don't go away just because you're not talking about them. They are still there. And the negative pain is what you feed your brain. So, you're kind of wondering, why am I always thinking negative? Why am I always finding the negative and stuff? Because it's there. It hasn't gone anywhere. But I'm not going to take this over, but I just wanted to share that with you.
Thank you. Thank you so much, Dr. Michelle Boone Thornton. I truly appreciate you coming forward to the stage. I appreciate that. So Dr. Kaba and Dr. Stroman, I do have a question for you in regards to how can individuals proactively manage or decrease their risk in heart disease? Either one of you. Dr. Kaba, being that you're off, your mic's open, how can an individual proactively manage heart disease?
So, okay, to manage the heart disease, we have many factors, as I said at the beginning. So, firstly, you need to manage the different factors to be able to manage the heart disease. The first factor is, as I said, we have 5 major factors. The first one is tobacco use. So we need to reduce tobacco use, and also physical inactivities. So people who are always sedentary, I mean, don't don't move or don't exercise, those people are really at risk to develop the different heart conditions. Also, the harmful use of alcohol. So we need to manage the consumptions of the alcohol. So this point is also very important to manage the heart disease. Unhealthy diets. Unhealthy diet is very important because we should not eat at any moment, and we should not eat everything at this. I mean, at night. At night, for example, we should not eat everything because during the night, human are not the same like during the day. That's why we really need to manage the diet. Also, the different hair pollutions, but this one will be a bit difficult for individual to be to manage. But what we really can manage as an individuals, we have tobacco use, physical inactivities, the harmful use of alcohol, and unhealthy diet. So if anyone try to manage this point, they can really manage the heart health conditions. Thank you.
Thank you, Dr. Kaba. And just a side note, anybody have any questions, please put them there in the chat. And also put your contact information, how we can connect with one another. Dr. Stroman, would you like to add anything to that? Let's do what Dr. Kaba said.
I mean, I think he went through the majority of them. Decreasing and stopping smoking, alcohol use, limiting it to either very small amounts or not at all. Healthy sleep, exercise, at least 30 minutes of moderate exercise. If you can do every day, it'd be great, but at least 3 to 5 times a week, it'd be better for you as far as getting down your weight into a healthy weight. Healthy foods, so lean meats, fruits, vegetables, healthy fats. I got some little bag of nuts, some almonds and cashews that I'm eating. Managing cholesterol, blood sugar, if anybody has history of diabetes, like all that stuff. Diabetes wreaks havoc on our vascular system. So managing other health conditions that one has, seeing a doctor regularly, following up with their primary care doctor. If you don't have a primary care doctor, getting a primary care doctor is very important. Just managing life as much as possible.
Okay, we have a question from Carol. Carol, feel free to ask a question. You can come off mic, off of mute.
Yeah, sure.
Okay.
Hi, everyone. So it's more like a reflection other than a question itself, but it may end up in a question. So Dr. Stroman was talking about some symptoms that are all related to depression. So those are hard symptoms, and maybe this thing or how you feel because you don't eat enough or because you eat too much, or it's like you're talking about the deregulation of everything if the heart is not working fine, right? But I was wondering how many times or how much these symptoms are confused with depression, and how many times do you need to refer to a psychologist or a psychiatrist your own patients, right? Or vice versa, maybe you get some patients from another doctor.
So for the most part, I think nowadays it's becoming a standard in doctors' offices for every visit. Patients should be getting screened for depression symptoms and anxiety symptoms, should be. I can't say that that's across the globe, but screening for depression is the first thing to start with. Asking those questions: do you feel sad? Or have you had any sadness lately? How often are you having these sad moments? Are you sleeping well? Are you sleeping too much? Not enough? Are you eating? Are you eating too much? Not enough? So the first part is just asking the questions and finding out what's going on with your patient. Medication, psychiatric medications are out there, they're helpful, but sometimes it may just be managing life stressors. It may be, oh, I'm depressed, but I have some stress going on at night. Going on in my life. And once those stressors are either alleviated or managed some way, their depressive symptoms get better. But there are some patients that have what is called major depressive disorder, where they do need to be managed with a doctor. They may need to be on medication, or they may just do therapy to help manage their symptoms. The goal right now is, the first thing is getting patients into the doctor's office, having the conversation, and then working with their provider, their primary care doctor, to determine, hey, do I need to be on medication? Do I need to see a therapist? Do I need to see, a dietitian? Maybe they're depressed because their weight is too, they're overweight, and that's causing some depressive symptoms. Maybe they need to see a dietitian or a nutritionist to help them with better eating choices. It could be a variety of things that can help in that instance. And it's not just one thing or another thing. It's our body is not just, well, my heart or my brain. It's the whole picture in general. So it starts with your primary care doctor, I would say. Having those appointments regularly, making those appointments.
Thank you so much. Thank you, Dr. Stroman. We have a question
you.
from Michael Walker. Caro, thank you so much for your question. Michael Walker, you have a question, and then Ruby has a question also. I'm going to ask you a question after Ruby. Michael, thinking of my sister.
Okay, so my question for when it comes to heart disease, how soon should we have people tested? Because I think from what I've noticed, I've seen some people that have been affected by it where maybe it wasn't detected as soon as it should be. And by the point that it was finally detected, it was something major that was life-threatening. So what is your recommendation as a clinician?
Dr. Kaba, and you want to go first, and then Dr. Stroman? Dr. Kaba?
I think his screen is frozen.
Yeah, he's frozen. I think so. Dr. Stroman, you want to go ahead and take this, and we'll catch him on the other end?
Unfortunately, we are seeing more and more cases of children being diagnosed with obesity, their increased risk of type 2 diabetes in children. So it starts with, the pediatrician's office. It starts young. They're going to the doctor's office regularly, at least once a year. They're checking their weight, they're checking their height, they're seeing how what their growth trends are. And in that instance, the conversations need to be happening with parents in office with the children, as far as changing what the kids are eating, increasing their physical activity. I'm not that old. I'm only 39, but the older population, we were kids outside, playing outside. We had a lot of physical activity. Our parents kicked us out the house and told us we couldn't come back in the house until later on. We were playing, we're active. Nowadays, kids are more at home. They're playing on video games. So being more mindful with having the conversations with parents as far as physical activity and making sure the kids are eating well. And as the kids get older, making sure they have healthy habits as teenagers, But making sure, once they become an adult, 19, 20, they don't have somebody telling them, hey, you need to go to the doctor's office. They may not, they don't see a pediatrician anymore. They need to move over into a regular primary care or internist to manage their care. So making sure that everybody is having a provider, a primary care doctor that they can have conversations with, as somebody that's monitoring their weight, monitoring their cholesterol. That's one of the standard things that we check in a physical, an annual physical, is blood pressure, thyroid function, their diabetes status with the hemoglobin A1C, there's their electrolytes, to see what their kidney function is, their liver functions are. So, I mean, I think it starts young. It's supposed to start young with developing healthy habits. But as long as we are giving people the tools as they get older into adulthood, that they still need to follow up with the doctor regularly, not just when there's a problem. Oh, I'm sick, I got a sore throat, I got to go to the doctor, I got to go to the urgent care. No, you need to be going to the doctor every year at least to follow up.
Dr. Kaba, do you want to add anything to the question that Michael asked?
No, it's okay by my side. I did, it was breaking one moment by my side. It's okay, you can go over.
Oh, okay, no problem, no problem. So we have a question in the chat, and the question is frequent urination, especially at night, a sign of heart problem?
Pardon?
We have someone asking in the chat, is frequent urination, especially at night, a sign of heart problem?
Do you want me to?
Go for it.
Yeah, you can go.
It depends on the patient. For a man, frequent urination could be, enlarged prostate. It could be their diet, if they have elevated blood sugar. If they're elevated blood sugar, maybe having some symptoms of uncontrolled diabetes. They could be drinking a lot of fluid because they're very, very thirsty. And because they're very, very thirsty and they're drinking fluid, then they could be urinating more. It could be a variety of things. It doesn't have to specifically be a heart problem. There are some medications called diuretics that can cause patients to urinate more because they're excreting excess fluid to keep keep their bodies from holding on to fluid too much, and especially if they have any congestive heart failure symptoms. And that's why, possibly why the doctor put them on that particular medication. Or even some medications can be used to manage blood pressure. So it may have a diuretic component to it, but it doesn't have to always be a sign of a heart trouble. It could be a variety of things that cause frequent urination.
All right. Dr. Kaba, you had an aha moment there.
Yeah.
You want to share?
Yeah, I saw I saw now the questions in the chats in the
Yes.
chat.
Yes.
Yeah.
Uh-oh, you're on mute. You're on mute. Say it again.
Yeah. Yeah. These symptoms is yeah, it really depends, because it is more related to the diabetes than the heart problems. Let me sorry.
No problem.
Somebody's calling.
Not a problem.
Oh, I could.
Okay.
I said that these symptoms, it really depends. It is a bit difficult to say that it is related to the heart conditions, but it is more likely related to the diabetes during the night, having frequently need to urinations. So it is more likely a sign of the diabetes, as Dr. Stroman said. But if someone suffer from the signs, it will be good to screen or to check up all the different aspects from a clinician doctors to really have a good point related to.
Okay.
Over. Yeah.
You're breaking up, Dr. Kaba. There you go. Okay.
Yeah.
No problem. You're breaking up. So we have a couple of questions, Michael. I'll get to you. I want to get to a couple other people's questions. One is another question in the chat. Is it true that AFib only gets worse even with medication? Yuka, you're up next. I just wanted to pick your brain to see if you had any questions. Then Amelia, and then also it's Nicole. So the question is it true that AFib only gets worse even with medications? Then after that, we're going to go to Yuka, Amelia, Nicole, and then Michael. Okay.
We'll make it quick. We'll make it quick.
Yeah, because we only have 8 more minutes. So
I got you.
all right.
AFib, I would not say it gets worse even with medication. AFib can be controlled with medication. There are different types of medications that we can prescribe for a patient that has AFib because that's an irregular heartbeat. I can't go into the specifics with it. There are different medications that a patient can be on, or there are different procedures that can be done to try to reverse or stop the AFib from actually happening. So I would not say it gets worse even with medication. It could have just be that the patient may not be responding to that specific medication and need something different, or multiple modalities to help treat it.
Thank you, Dr. Stroman. Yuka, you're up next for a question.
Hello.
Hi.
Yes. Hi. Thank you very much for this insightful session. And I was in awe of these doctors who has a brilliant brain. My question is, how are these exponential technologies, starting from artificial intelligence to visual technologies to virtual reality to augmented reality, help you to exercise your profession?
Maybe let me start.
Okay.
Okay. This is a good questions. You know, we currently the recent we have the recent advancements in the heart disease treatment. So the different advancement, it is a bit difficult to explain without emphasizing on the technology advancement, like adaptable heart implants. Okay, this device was approved by the FDA, indicating that its potential to transform cardiovascular disease interventions. So an adaptable as heart implant has shown promising result in reducing heart attack rates and the need for repeat procedures compared to the traditional stent. If we try to compare now, I mean, technology advancement now to the traditional stent, we can see that there are more improvements. And positively impact on the health on the health heart disease conditions.
Okay. Dr. Stroman, did you want to add anything to that?
We got 4 minutes, so I'll get to the next question.
All right. Yuka, do you have one more question? I'm going to go to 2 more people. Do you have another question?
No, please go ahead.
All right. Amelia, did you have some questions?
Yes. I'd like to.
That's my mom.
I would like to ask a question to the doctor. Do they think that maybe frequent urination at night might be due to insomnia as a result of stress?
There can be a correlation between the two, as far as stress and the irritability or irritation of the bladder muscle, to cause more, I guess, spasming of the bladder muscle, which can, that spasming can make you, wake up to want to have to go to the bathroom. So that could be a possibility. Yes, ma'am.
Okay. Thank you. Thank you, Mom. Okay, Michael, you have a question and then we're going to wrap up. Michael Walker.
Yes, I do. I'm going to try and wrap 2 questions into one. So my question
you have 1
is,
minute.
how reliable is technology when it comes to not only just preventing heart disease for the future, but in curing it? Because I've seen discussions online where people mention gene editing, and Dr. Kaba mentioned that you can be predisposed based on your genetics. I think Dr. Stroman, you mentioned that as well. So is it really viable to actually edit genes in a way that someone who was potentially predisposed to having heart disease cannot have it, like for future generations?
Good question.
Well, I think that the advances in gene therapy and gene editing is, we're getting there closer and closer. Yes. I don't know when that's going to come about, how soon it's going to come about. As far as making that more of a standardized approach. I have my own thoughts on some of that too, as far as like phasing out some of these drug companies. So I'm not really sure how much that would play a role, as far as, how much patients will be able to benefit from. But I think just real quick, even like the smart watches, they have, blood pressure. You can do your blood pressure with those things. You can do your heart rate with those things. They can monitor your sleep. Some of those things are just really easy and accessible to patients nowadays, just to get a quick glance at what's going on within their bodies so that they can have that conversation with their doctors as far as their risk factors.
Thank you so much.
Real quick.
Thank you, Michael, Dr. Stroman. So we have a couple of more minutes. I just want to tell everyone, thank you very much. I want to share with you guys about Global Chamber, who's on our board. You met our board chair earlier today, Dr. Anthony Piccolo, Jacob Dietz, Nelson Alvarado, Jennifer Thornton's on our board. You see me as the executive director. We have Jean Monafiston, Dede, we call him Stefanie Harris, Jeff Papas, Prosper, Michael Wesley, as he's here with us today. We also have Diane Uritia, and we have several other vacant positions on our board. But in order to be a member, we would love for you all to join us, to become a member if you're not, learn more about Global Chamber. When you do join, select the Dallas location. If you're here in the Dallas location, if you're somewhere else, so there's always one in your city. We've had our discussion. These are upcoming meetings that's coming up next. Global Chamber has over 700 meetings a year. Virtually, like 95% of them virtually, other 5% are in person. We have our Global Chamber author meeting that's coming up. That's on February 19th, which is tomorrow. And Dana Austin, who happens to be my sister, she is she's over that particular Global Chamber Book Author Club. We have our Virtual League Extraordinaires, our monthly AI series. We have so many wonderful, phenomenal topics with Global Chamber that you all can just jump on and gain a wealth of knowledge. We have our Phoenix Export League session coming up, and we have our Global Chamber Accra meeting that's coming up. Ruby's on the call with us, and that's on February 25th. We'd love for you all to join there. You guys have asked questions. I wanted to put a heart. Please be mindful. Last question, Dr. Stroman, what type of exercise can we do in our chair? Dr. Kaba, give us one exercise we can do in our chair when we're sitting down. One exercise. Dr. Stroman, on you. Then Dr. Kaba, you're next. Okay, yes. Okay, what else? Dr. Kaba, what exercise can we do? Oh, yeah, boxing in the chair. Okay. Dr. Kaba, what exercise?
Yes, I agree. This
You
exercise
agree?
Yeah, this exercise is very excellent.
Okay, and so I think you can also, there's like a lift, you can lift yourself up in a chair with your arms and things that with your legs. So if you're sitting down at home or at work or wherever you are, do some arm exercises, boxing, stretching. You know, if we look at animals, cats and dogs, when they get up, they always stretch. We need to stretch. You can always stretch. Thank you all so much. It has truly been phenomenal. I appreciate you, Dr. Kaba, Dr. Stroman. Thank you so much for your time. And please make sure we get a good snapshot here with all three of us in the room. Michael, Lily, you all take the picture with all three of us on the screen so we can share that with everyone. So make sure we're smiling. You got it, Michael?
I did.
Okay. All right. Thank you, guys. Ruby, thank you. It's good to see you. All right. Take care, everyone. Bye-bye.
Bye.
Bye.